Dr. Tingen, thanks for being with us again. We appreciate you.
Oh, I always love to come on your show, Brad, so thank you very much for this invitation.
Absolutely. I want to talk about the grant that you received and how it's going to help serve areas of our community that might not be getting the medical attention that they need and certainly deserve. But let's take a look at populations in our community and how they are succumbing to, if you will, the coronavirus more than others, especially the African American community. Studies have shown that they get the coronavirus more than other folks. Why is this?
Yeah. Well, I think there's a really good reason. If you look at all the health disparities related to stroke, related to diabetes risk, related to rates of obesity, related to cardiovascular disease, and I could lump all of those into something called chronic illnesses. Anyone that has a chronic illness, Brad, is at much greater risk for getting COVID-19. And many people that are even youthful that are greatly obese or morbidly obese are getting COVID-19. That can be a primary risk factor. So there's great disparities among the African American community with chronic illnesses. And sometimes those chronic illnesses are not well controlled. So that makes them much more susceptible. Inflammation in our bodies is a very interesting thing. And when we get COVID-19, of course, we know that it's a viral infection. So when our body has, inflammatory things going on from other diseases or conditions that are not well controlled, it's a perfect setup for being attacked by an outside host called COVID-19.
Dr. Tingen, by the way, thank you to the good folks at Zoom. Apparently they have let our meeting continue. We appreciate that. You'll see what I mean when you watch the tape of this. Something just popped up on the screen. Let's take a look at the grant that you've received, a grant that will help you address underserved portions of our community, which leads to the question, have you had time yet to see which parts of our community are underserved? And am I asking the question right? Is it neighborhoods? Is it parts of the CSRA where you can say, okay, this section doesn't get the medical care it needs?
Absolutely. So I'm very thrilled that the BristolMyers Squib Foundation, who we have a wonderful relationship with, and I'd love to come back again one day and share a new grant we just got for $3.38 million with them to address health disparities related to cancer. But I'll stick to the COVID-19 today. So I got a quick phone call and they asked if we needed any dollars to address, and they said the most they would award be $20,000. I said, $20,000? They said yes, and I said, okay, can I ask for more? They said, you can ask for more, but that's kind of the limit. So I put together a proposal with double that for about $40,000, and I immediately got on the phone and called several of my great contacts that I work with on a regular basis, collaborators in the community, basically among the African American churches and their leadership, their pastors. And I said, if we had dollars to impact your communities, do you know where the greatest needs are? I said, I've done a few stats, but I want your opinion. They immediately said, oh yeah, Burke County's in great need, Jefferson County's in great need, Warren County, Lincoln County, McDuffie County, even parts of rural Columbia County. And there's even things perhaps in Richmond County, although Richmond County has been taken care of well related to one major need of COVID. And so this grant addresses all areas of how can we meet needs of people. So the first need that I was very worried about is a lot of people don't realize this, Brad, but food insecurity, not having food to eat, is a very real thing for many school systems in rural areas as well as in Richmond County.
Yeah, let me jump in and ask you this. You're right. That insecurity is a legitimate thing. We've covered it here during our newscasts, and there's a constant effort to make sure that food gets to those people. So if we're looking at medical care, Dr. Tingen, in those rural areas you mentioned, is it a matter of people not having the means to drive into town to see the doctor? And if so, are your efforts primarily going to be bringing the doctors to them?
So what we've tried to do is we have done an educational intervention, and we have provided them tangible resources and connected them with resources of how they can get help. And when I say tangible resources, so earlier in talking with Dr. MacArthur, we have provided them over 1,000 masks.
Wow.
And demonstrated how to properly wear them. We have provided them over 100 touchless thermometers so that they're the same type we use before you go to the hospital and work every day to see if you have a fever. We have provided them over 800 sanitizers. We have provided them over a mailer that looks much like this, and that has one of the leaders of our area, who's the president of the 10th district of all the counties I mentioned. And so we have kind of a three-part message, and it all relates to medical care. The first thing is protect yourself and others. And we have on there the importance of wearing a mask and wearing it properly, and 6 feet. And we have, what is 6 feet? Is stretching your arms out all the way. That's a good measure of 6 feet. And it has other things about protecting yourself and others. When I think about protecting yourself quickly, Brad, you know, if you're on an airplane and you're going to be a crash or something, they say put your mask on first so you can help somebody else.
Yeah.
I say in COVID-19, put your own mask on first. And then if you come across somebody that doesn't have one, they need to get a mask on also.
Have you noticed, you know, some people, whether they're in served or underserved parts of our community, just don't trust doctors. And so it's not that they don't have access to the care. They just don't trust y'all and don't want to go. Have you run into that yet? And if so, how can churches step in and be your go-between and establish that trust?
Well, one of my goals has been, and I don't take all credit for this, I have an amazing team of individuals on my research team that we work with. And so don't think this is all Martha Tingen. This is a wonderful team that we've assembled over the years. Some of them have been with me for 14 and 15 years. We have developed relationships with the community, and they know one major thing. They know I care about them, and they know our team cares about them. And I'm very proud, and I say this with gratitude and thankfulness. I say I work for the Georgia Cancer Center at the Medical College of Georgia. They know both of those names, especially the Medical College of Georgia and the Georgia Cancer Center at Augusta University. Mm-hmm. And when people know you are sincere and you care about their health, you know, this is just a quick little blurb on the side, but I was on the phone yesterday with 5 countries from Africa with 21 individuals in a virtual meeting, MDs, PhDs, RNs, medical assistants. We are training them on a program that we implement here that will be translated into 15 languages there. So and then, you know what? They know that we care about them. We're developing a collaboration with them. But I want to get back to the 3 main points of this.
Yes, ma'am. Keep an eye on the clock. Dr. Tingen, keep an eye on the clock because our time is starting to run out.
So protect yourself and others. The other is respect guidelines. If you feel sick, do not get in the car and drive down to the Medical College of Georgia or anywhere else at Augusta University. You call your doctor first, okay? Now, if you can't breathe and you need medical attention, you call 911 immediately. Don't misunderstand me. But if you think you have some symptoms of COVID, you need to get in touch with someone to see what your next action should be. And often that's to be tested. If you ever have shortness of breath and can't get your breath and you feel very ill, then absolutely seek the medical help. The third is connect, and that means stay informed with what the latest data is. There is so much information out there. So we have put this in a very lay language way. We mailed out over 40,000 of these to the particular communities, and tons of people have called and said, I didn't know half that stuff. We have the really neat symbol on here where you can see a really cool thing that's put out by a hip hop group about washing your hands.
Dr. Tingen, let me jump in. Let me jump in and ask you this, because that card that you mailed out is incredible. And I hope a lot of people, those 40,000, are studying it closely. Let me ask you real quickly, though, we have 45 seconds. When you live in a household with a lot of folks, that social distancing, that 6 feet that you illustrated, can be tough. How do you social distance within your own household if there are a lot of members, or do you need to since you're all family?
So this is my philosophy on that. I am very big on the moment you walk in your house, you go wash your hands really well. Mm-hmm. I'm a little OCD, and so then I do a major sanitizer on my hands. I also wash my face time I get home. with something that's antibacterial, antiviral, anything I can.
Yeah.
And so in the house, I don't social distance from my husband. I will be the first to say that. But we have very specific guidelines of keeping our countertops clean and all those types of things, because you want the cleanest environment you can have inside your home.
Well, that's so true, and it all does start in the home. Dr. Tingen, you've done so much hard work with your team on cancer, now the coronavirus. Thank you for helping this entire community. We appreciate you, and we'll have you back soon.
That'd be great. Thank you so much, Brad, for this opportunity.
Dr. Martha Tingen with the Georgia Cancer Center.